In your morning checkup, CDC says older American adults are increasingly dying because of falls. Dr. Janelle Gordon is Wish TV's medical expert and here to sort of guide us through the difficulties of this and the realities as well. I guess on the thought of falls, the kind that can be catastrophic, who's at risk?
So we know that older individuals ages 65 years and older at most risk. And then also when the demographics were reviewed, it showed that Caucasians and males in that age group are at most risk.
And without getting too deep into the details of it, our family's dealing with something exactly similar to this right now. I didn't realize how quickly things can cascade, how what would just look like maybe a broken hip can lead to so many more terrible problems.
Very much so. I myself have had similar experiences. As you know, my mother had a stroke a few years ago, and we've dealt with many falls because she does have gait abnormalities now and walks with an assist device. So we know that after an individual in that age group has a hip fracture, especially as the age continues to rise towards the 70s and 80s, the risk of significant decrease in day-to-day activities as well as risk of death is astronomically high.
Let's look at the rates when we're talking numbers right now. Where do we stand?
Yes, so the latest data looked at our demographics from 2003 to 2023, and what it showed is that the rate of death from unintentional falls in individuals 65 years to 74 years of age rose over 70%. And actually in 2023 there were 40,000 deaths as a result in that age group from unintentional falls.
What are some of the risk factors that could lead to this eventuality?
Yes, so various medical conditions can increase an individual's risk, including vision and hearing problems, inner ear issues that could cause balance issues, dementia or confusion, neuropathy, circulation issues such as peripheral vascular disease, postural hypotension, or individuals who their blood pressure drops too low when they go from a lying or sitting to a standing position, urinary incontinence, fecal incontinence as well. We also know that individuals who are on diuretics or pills to help their blood pressure, help them urinate, can increase your risk. We really try to avoid sleeping aids in this population because of the risk of falls, especially at night. Improper footwear. So when I see my patients, if I see them wearing backless shoes, heels that are too high, we really try to encourage them to get proper fitting shoes that aren't too big or too small.
Right.
And we also know that polypharmacy is a huge issue. So studies have shown that when individuals in these age groups go from taking 1 or 2 medications to 5 to control all of their chronic conditions, there is a risk of falls. And not only because dizziness is a common side effect for these medications, but when you start taking that number of medications, there's a risk of possible interactions amongst them.
And this kind of takes us off in another direction, but there are so many specialists now, all prescribing different medicines. Is this a good time to get with your family doc and make sure everything's agreeing with each other?
Scott, we're on the same page.
Happens every once in a while.
So this was one of my biggest issues when I was doing primary care. I would see consult notes coming in from the cardiologist, the nephrologist, or kidney doctor. Maybe they're also seeing a therapist for different issues, a psychiatrist. And I'm looking at these meds and I'm noticing changes in their lab measurements, or their family members or even the patient themselves are mentioning that they're having some signs and symptoms. And you take a step back and say, we really need to decrease this list of 15 or 20 plus medications, right? So I highly encourage individuals to meet with your primary care doctor and routinely review your list and make sure you understand why you're taking medications. That's another thing I found. People were just taking these meds because the doctor 20 years ago said, I have to stay on it forever. And also for individuals like my mother who do use assist devices, it is a good idea to have your medical equipment reviewed routinely, either by the medical company that gives you the device or by a therapist.
All right. Back to the topic of falls.
Yes.
Prevention's important if you can figure out ways to head this off.
Yes, yes. And so I encourage individuals to have their hearing and vision screened routinely. If you are wondering if your bone density is at where it should be, or even your vitamin D, make sure you get that screened routinely.
Okay.
Make sure that you're taking in an adequate amount of dietary calcium and getting direct sunlight, because that helps with our vitamin D stores. One thing we cannot stand with this age group is in the homes, throw rugs. Get rid of them. People will use the sticky pads to keep them to the floor. For a larger area rug, that might be okay. Make sure that corners are secured, but those small throw rugs, out of the house, please. And then it is a good idea to use an emergency response system thank goodness we have these smart devices these days, and you can set that up. Alexa, call 911, that type of thing, or have your family members on speed dial to where it can be alerted. If you don't have those type of devices, there are always the bracelets and necklaces that you can utilize.
A lot of information, but a lot of families are dealing with this.
Yes.
Do we know why the numbers are spiking? You would think that with treatment improving, that the death rates wouldn't be going up.
So more information, more research needs to be done on that area to gain that information. What I will say is, I'm always saying this, I feel like every week that I come, we are really losing that village experience where we had the multiple generations in the home, and then we're so spread out now. We may not have family members in the area. This is another good idea for you to reach out to your primary care doctor, local health department, or aging agency in your area to see if you can get support services for that individual.
Good stuff, important stuff as always.
Yes.
Dr. Janelle Gordon, our medical expert here at Wish TV. Thank you.
Thank you.